almost 35 years working in public health, and I spent about 12 years in Rwanda right after the genocide in '94. And then moved to the US, worked for another international organization for 12 years, and I joined the foundation 2 years ago. So in total, I've been working for the government, working with the people in the villages, and obviously in those days was a very tough place, and went to the other side to work as an international NGO to support countries, and now also on the donor side, when I can actually see the needs of the country, the needs of the donors, and then try to combine those both elements. Sometimes it's easy, sometimes it is not.
That's a stark contrast. When you first went to work abroad, how was that experience?
It's it gives you another lens of seeing the development, because sometimes when you are working every day, you don't see the big picture in the global community, how the trajectory has evolved. We have to admit that there has been a huge progress in the developing countries. And I'm talking about Rwanda, which is my country, have seen tremendous improvement in healthcare, in socioeconomic, and so forth. But at the same time, it's also partially because there is a support coming from international communities, and that Rwanda has been able to harness that collaborations and use it to the effective way to support the very needy, which is the population. So to have that marriage between those two interests really requires, I would say, to have both experiences. So that's my role these days, really to try to bridge those gaps, and here or other countries where we do support.
You spoke about some of the successes of Rwanda in achieving UHC. Do you think that Rwanda can serve as an example to other countries, or do you think that every country kind of has to use their own processes to achieving this goal?
I really believe that Rwanda, of course, it's used as an exemplar in the public health, and actually have shown tremendous, success in improving the life of the people, introducing, you heard this morning, the community health insurance, which covers 90% of the population, and more other, activities that are certainly homegrown. But I think the essence and the key element of what Rwanda did is applicable to other countries. And I'm seeing actually good and positive trend in many countries that actually came to Rwanda for a study tour, and obviously they use and repackage it to suit the context of their countries. And I also see a lot of, these days, the platforms that are basically cross-fertilization, cross-learning between countries, and Rwanda is playing its a key role, but I can also see some of the examples coming from Ethiopia, from Ghana, from Liberia, like in the community health. Now it's really borderless, but Rwanda certainly continued to pioneer in many fronts, including very recently in technology, how to reach the more rural people, improve the access of the communities using the technology. This is something countries are looking. I met several people this morning trying to learn more about Rwanda. But again, every country has a different path, but I think the ultimate goal is the same. We have all committed to achieving SDGs in the next decade, and in the public health, science is there to tell us that we have intervention that is very effective. We have strategies that have worked. So it's really the matter of commitments to achieve those.
You just mentioned it. There are strategies there are tools there, science is there. What do you think is the reason why it's sort of taking so long for this to be achieved in so many different African countries?
I think the most important thing is probably the political commitment. I guess when you look at what Rwanda did with so little in terms of financing and human capital and so forth, we realized that if you need a key ingredient, which is a political commitment. Second, it's also, I think, having a critical mass of people who are, I would say, have the technical skill to implement, because those strategies, it can be good on the paper, but when the the devil's in the details. So when you start implementing, you definitely need people who have the technical knowledge. That's where I always say Africa has a potential to leapfrog, using their own young people who are going to study abroad, even in the country, but at the same time continuing to, why do you want to invent the wheel? So that's the collaboration with the international community, which can actually bring the knowledge, the R&D that have already been done in their own settings, but political commitment becomes the key ingredient. Then obviously the finance is the second.
Right, and that's what I was going to ask actually. How can a country or government make sure that all hands are on deck to make sure that this is achieved when it can be quite expensive actually?
It is. In fact, if you look at what it requires today to achieve SDGs, Sustainable Development Goals, if you look at the current funding for the primary healthcare systems in Africa, the average spent is about $36 per capita and per year. And if you make that projection in the next decade, countries in Africa need to double that amount. So there are two ways of achieving it. One, obviously, is to increase the domestic financing. Countries in Africa have committed to Abuja Declaration to put at least 15% of the national budget for health. That would be one way. The second is to use better the existing funding. It's basically to reallocate some of the funding that we see. You heard this morning about the government in general in Africa spent 40% to the primary care, and the rest is for the tertiary care. So that reallocation and prioritize primary care, which can meet 90% of the population health needs, could be one of the ways. And then I say there are a couple of countries already who have achieved the Millennium Development Goals, who are certainly likely to achieve SDGs, and they are not spending more money on health per person than others who are even much richer. So again, it's just a rebalancing and using appropriately the existing funding.